1. A nurse is caring for a patient newly diagnosed with type 1 diabetes. Which initial teaching should be prioritized to ensure patient safety? Answer. The nurse should prioritize teaching the patient how to recognize and manage hypoglycemia. Rationale. Hypoglycemia can lead to life-threatening complications and is more immediate than long-term effects like neuropathy or retinopathy. Recognizing early signs is essential for patient safety. 2. A patient with type 2 diabetes is admitted with a foot ulcer. Which assessment findings should be reported to the provider immediately? Answer. A foul-smelling wound with purulent drainage and fever. Rationale. These findings indicate possible infection or cellulitis, which can rapidly worsen in diabetic patients and require urgent medical intervention. 3. During shift report, a nurse is assigned to 4 patients. Which patient should be assessed first? Answer. The patient with type 1 diabetes who is confused and diaphoretic. Rationale. Confusion and diaphoresis are signs of hypoglycemia, which is a medical emergency requiring immediate intervention. 4. A patient with type 2 diabetes is scheduled for surgery. What should the nurse do regarding the patient's oral anti-diabetic medications? Answer. The nurse should hold the oral anti-diabetic medications and notify the healthcare provider. Rationale. Oral antidiabetics are usually held before surgery to reduce the risk of hypoglycemia during fasting and anesthesia. 5. A nurse is teaching a patient how to administer insulin. Which technique should the nurse emphasize to prevent lipodystrophy? Answer. The patient should rotate insulin injection sites within the same anatomical area. Rationale. Rotating injection sites prevents tissue damage and promotes consistent insulin absorption. 6. A nursing assistant is assigned to assist a patient with diabetes who has peripheral neuropathy. What task should the nurse delegate to the assistant? Answer. The nurse can delegate helping the patient with bathing. Rationale. Bathing is within the nursing assistant's scope. However, the nurse must assess skin integrity and instruct on safe water temperature use due to sensory deficits. 7. A nurse is reviewing the lab results of a patient with diabetes. Which finding requires immediate intervention? Answer. A blood glucose level of 42 milligrams per deciliter. Rationale. This level indicates severe hypoglycemia, which can lead to seizures, coma, and death if not treated promptly. 8. A patient with diabetes reports new-onset blurry vision and headaches. What is the nurse's best initial action? Answer. Check the patient's current blood glucose level. Rationale. Blurry vision and headache can result from hyperglycemia or hypoglycemia. Checking the glucose level helps identify the cause. 9. A nurse notices that a diabetic patient's insulin has been stored at room temperature for over a month. What should the nurse do? Answer. Discard the insulin and obtain a new vial. Rationale. Insulin stored at room temperature is typically stable for only 28 days. Expired insulin may be ineffective and unsafe. 10. A nurse caring for a diabetic patient on insulin therapy notices the patient skipping meals. What should the nurse do first? Answer. Discuss the importance of meal timing with insulin administration. Rationale. Skipping meals while on insulin increases the risk of hypoglycemia. Education is essential to prevent this complication. 11. A diabetic patient becomes unconscious during breakfast. What is the nurse's priority action? Answer. Administer glucagon intramuscularly or subcutaneously. Rationale. Unconscious patients cannot safely consume oral glucose. Glucagon quickly raises blood sugar and is the safest option in this scenario. 12. A nurse is preparing to discharge a patient with newly diagnosed type 2 diabetes. What is the most important topic to address? Answer. Educate the patient about monitoring blood glucose levels at home. Rationale. Self-monitoring is critical for maintaining glycemic control and preventing complications. 13. A patient with type 1 diabetes has a serum potassium level of 6.2 milliequivalent/L. What should the nurse assess for next? Answer. Evaluate the patient's cardiac rhythm. Rationale. Hyperkalemia can cause life-threatening arrhythmias, so cardiac monitoring is a priority. 14. A nurse is teaching foot care to a diabetic patient. What instruction is most important to include? Answer. Check your feet daily for cuts, blisters, or swelling. Rationale. Diabetic patients are at risk for neuropathy and impaired healing, so daily foot checks help prevent infections and amputations. 15. A diabetic patient is NPO for a diagnostic procedure. What should the nurse do about the patient's morning insulin dose? Answer. Consult with the provider about adjusting or holding the insulin dose. Rationale. Administering insulin while NPO can cause hypoglycemia. Provider input ensures safe dosing. 16. A nurse is caring for a diabetic patient who is on corticosteroids. What should the nurse closely monitor? Answer. Monitor the patient's blood glucose levels frequently. Rationale. Corticosteroids can cause hyperglycemia, requiring closer glucose monitoring and insulin adjustments. 17. A diabetic patient is admitted with dehydration and confusion. Which condition should the nurse suspect? Answer. Hyperosmolar hyperglycemic state, HHS. Rationale. HHS commonly presents with dehydration, confusion, and very high blood glucose levels without significant ketoacidosis. 18. A nurse is teaching a diabetic patient about sick day management. Which instruction is essential to include? Answer. Continue taking insulin even if you are not eating as usual. Rationale. Insulin is needed to prevent hyperglycemia and ketone formation, even during illness. 19. A nurse notices a new graduate preparing to administer insulin to a patient with low appetite. What should the nurse do? Answer. Instruct the new nurse to ensure the patient is eating before administering insulin. Rationale. Administering insulin without food intake can cause hypoglycemia. Proper timing is essential. 20. A diabetic patient is started on an insulin pump. What is the nurse's priority in education? Answer. Teach the patient how to monitor blood glucose and respond to pump malfunctions. Rationale. Insulin pumps deliver continuous insulin. Failure can cause rapid onset of DKA, so monitoring and troubleshooting are vital. 21. A nurse is caring for a diabetic patient who is receiving total parenteral nutrition, TPN. What should be a priority nursing intervention? Answer. Monitor the patient's blood glucose levels regularly. Rationale. TPN solutions contain glucose and can cause hyperglycemia, especially in diabetic patients, requiring close monitoring. 22. A nurse is reviewing the diet plan of a patient with type 2 diabetes. Which dietary recommendation is most important to emphasize? Answer. Emphasize the importance of consistent carbohydrate intake throughout the day. Rationale. Consistent carbohydrate intake helps maintain blood glucose stability and prevents spikes and drops. 23. A diabetic patient is experiencing signs of diabetic ketoacidosis, DKA. What is the nurse's priority intervention? Answer. Start 4 fluids with normal saline and notify the provider. Rationale. Dehydration is a primary concern in DKA. For fluids help restore volume and perfusion while preparing for insulin administration. 24. A nurse finds a diabetic patient unconscious with a blood glucose of 35 milligrams per deciliter. No for access is available. What should the nurse do? Answer. Administer glucagon intramuscularly. Rationale. IM glucagon is the best option for rapidly increasing blood glucose in an unconscious patient without for access. 25. A patient with diabetes is being discharged after hospitalization for DKA. What statement indicates a need for further teaching? Answer: I'll stop taking insulin if I get the flu and can't eat. Rationale: insulin should never be stopped during illness, even if oral intake is reduced, to prevent DKA recurrence. 26. A nurse is educating a patient about insulin pen use. What instruction is most essential to include? Answer: prime the pen before each injection to ensure accurate dosing. Rationale: priming clears air and ensures full dose delivery, which is critical for effective glycemic control. 27. A patient with type 1 diabetes uses a sliding scale insulin regimen. What is the nurse's priority action before administration? Answer: check the patient's current blood glucose level. Rationale: sliding scale dosing is based on current glucose readings, and administering without checking can lead to incorrect dosing. 28. A nurse is caring for a patient with diabetes who reports tingling in both feet. What is the nurse's best initial action? Answer: assess for signs of peripheral neuropathy. Rationale: tingling is a classic sign of neuropathy, a common complication of diabetes, and requires further assessment for safety risks. 29. A diabetic patient complains of nausea and vomiting for 2 days. Which symptom requires immediate medical attention? Answer: fruity smelling breath. Rationale: fruity breath suggests ketone buildup and possible DKA, which is a medical emergency. 30. A nurse is caring for a diabetic patient who is at risk for impaired skin integrity. Which intervention is most appropriate? Answer: inspect the patient's skin daily, especially the feet. Rationale: daily inspection helps detect early signs of pressure injuries or ulcers, especially in diabetic patients with neuropathy. 31. A nurse is teaching a diabetic patient how to treat mild hypoglycemia at home. What should the nurse recommend? Answer: consume 15 grams of fast-acting carbohydrate, such as juice. Rationale: the 15 to 15 rule helps raise blood sugar quickly and is a standard treatment for mild hypoglycemia. 32. A diabetic patient is started on metformin. Which instruction is most important for the nurse to include? Answer: do not take metformin if you are scheduled for a contrast imaging study. Rationale: metformin can cause lactic acidosis when combined with contrast dye. It should be temporarily discontinued. 33. A nurse is preparing to administer insulin aspart. When should the nurse ensure the patient begins eating? Answer: within 5 to 10 minutes after administration. Rationale: insulin aspart is rapid acting and must be paired with food to prevent hypoglycemia. 34. A nurse is caring for a diabetic patient with chronic kidney disease. What adjustment should be anticipated in their insulin regimen? Answer: a reduced insulin dose may be necessary. Rationale: kidney impairment can reduce insulin clearance, increasing the risk of hypoglycemia. 35. A patient with newly diagnosed type 1 diabetes is fearful about self-injection. What should the nurse do first? Answer: assess the patient's understanding and specific concerns about injections. Rationale: understanding the patient's fears allows the nurse to address them directly and provide personalized education. 36. A diabetic patient has poor vision. What teaching strategy is most appropriate for insulin administration? Answer: use a talking glucometer and pre-filled insulin pens with tactile markings. Rationale: adaptive devices promote safety and independence for patients with visual impairments. 37. A nurse is reviewing insulin administration with a patient. What indicates the patient understands how to prevent hypoglycemia? Answer: I'll always carry glucose tablets with me in case my sugar drops. Rationale: carrying fast-acting sugar ensures the patient can treat hypoglycemia immediately, especially when away from home. 38. A diabetic patient is experiencing polydipsia and frequent urination. What should the nurse suspect? Answer: the patient may have poor glycemic control. Rationale: hyperglycemia causes osmotic diuresis, leading to thirst and frequent urination. 39. A nurse notes that a diabetic patient has thick, brittle toenails and limited mobility. What is the nurse's priority intervention? Answer: refer the patient to a podiatrist. Rationale: improper nail care can lead to infections and ulcers in diabetic patients. A podiatrist ensures safe management. 40. A diabetic patient says, "I feel fine, so I don't need to check my blood sugar." What is the nurse's best response? Answer: even if you feel fine, your blood sugar could still be too high or too low. Rationale: blood glucose levels can fluctuate without noticeable symptoms. Regular monitoring is essential for safety. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!